Well, with the federal budget just days away, perhaps no disease focuses attention on spiralling health costs more than dementia. In the decades to come, the number of people diagnosed with dementia is set to soar, and so is spending. And many health experts say we're just not ready. Social Affairs correspondent Norman Hermont reports.
This is now routine for Dan and Jane Gardam.
So tomorrow, which is the 27th, you've got a haircut at 10:40.
Every day of every week, reminders fill a small notebook for Dan, who was diagnosed with early onset dementia at age 61.
You're trying to just creep away from things.
He is the same Dan, but not the same Dan, I suppose, because it's watching the struggle is the hardest part.
By 2020, it's estimated 400,000 Australians will live with dementia, and the challenges to the health budget in the decades to come will be immense. Spending on dementia is projected to rise from $5 billion a year today to nearly $21 billion a year by 2030. Alzheimer's Australia says we're not ready.
I don't think Australia is yet prepared for the huge challenges, the economic and the social challenges that we will face.
To assist our person living with dementia who has...
Part of the cost will come from training the 240,000 aged care workers who care for dementia patients. Here, one group is learning the Montessori method that focuses on the patient's strengths and abilities. Why is this important?
That we need to find ways to keep people engaged. We're only touching the edge of the work that could be done in our society.
There's also the productivity toll on the economy as dementia forces skilled employees from the workforce. For Dan Gardam, it was clear he'd have to stop working soon after he was diagnosed with early onset dementia.
He was planning to work for at least full-time for at least another 5 years. One day he was working with an income, the next he wasn't.
They've adjusted to their changed circumstances. Australia will have to do the same. Norman Hermont, ABC News.